Well, my name's David Ludlow. I was born in North Carolina while my father was going to medical school, but I grew up in Spanish Fork. We moved back here when I was about 4 years old. I was away for 15 years for school myself. I went to Duke University, and then I did my residency in the military. I did my first 10 years of medical life in the military, and I moved back to Spanish Fork in 1991, and I've lived there ever since. I do have 4 children. They're all grown and families of their own, moved away, and now I get to enjoy my grandkids. Over the last 20 years, I've had an opportunity with the military to visit a variety of countries, most of which are developing countries, doing mostly women's health care. And I hear stories because, different than the United States, it's not uncommon for women to die during childbirth or complications of pregnancy. And you hear how that so adversely affects the family. And blessedly, here in the United States, we don't see it very often, but it just has taught me how important women are, not just to themselves, not even just to their kids, but to the whole family. Having been part of now over 5,000 births, I get some feel of what it is to bring a new life into the world. And so always that is a key part of enjoyment of my practice. I also like surgery. The challenge of trying to fix something that's broken and put it back together has always excited me. And then I also like education. There's a lot of women who have questions, but understanding how your body works and why things go this way or why things go that way, and explaining it so that people can understand is, I think, the third reason why I like OBGYN. Well, I think purposefully we've tried to set up our schedule so we're not so rushed, because I think beyond taking a history and doing an exam and coming up with a diagnosis, an important part of the visit is trying to educate the woman why the suggestions I'm making are important and how they will affect her health. And I think that by explaining things so that she can understand, then we can be a partner to try and get the best outcome possible. I had an opportunity at one point in my career to be deployed with a bunch of Navy SEALs and Army Special Forces soldiers, and even though I was probably 30 years older than most of them, by trying to keep up and stay up and emulate their exercise program, I think I was the strongest that I've ever been. It's just shown me that whether you're in your 20s, 30s, 40s, or even 70s, you can be active, you can be healthy, and you can do much more than what you would have thought you could do at that age. And so as I talk with patients, I try and emphasize the importance of being active, being careful of what you eat, and just generally being judicious in how you live your life.